applaud those at various health institutions who are doing their work as required, and please keep up the good work. But there are some health workers at some health institutions that are only there to collect salaries. Some are very rude, scream at patients, insult patients constantly while they are supposed to work on their cell phones, while patients are waiting for service in long queues. In Gunen region, we have 3 district hospitals at Opuo, Korigas, and Ocho, whereby Kamiap has a health center, while the rest in the region has clinics. Most of these clinics without qualified health workers. The distances between the clinics and the district hospitals are very long, and the transport used to collect the patients are taking long, or some vehicles are not up to standard that patients transport while waiting to be collected are passing on. My advice will be to have a proper transport at the far clinics from the district hospitals, so that whenever there are emergencies, the patients can be brought in from the clinics rather waiting transport from the district hospitals. The other issue is the referrals from district hospitals to Windhoek that are really costly, time consuming, as sometimes patients are passing away while they are rushed to Windhoek. Let me illustrate the distances from the 3 district hospitals to Windhoek. From Korigas to Windhoek is 450 kilometers times 2. Opuo to Windhoek 733 times 2. Ocho to Windhoek is 370 times 2. One should suggest that if the government should have built a fully fledged referral hospital in Ochivarongo, which I believe is a little bit central from all corners of the country, then we can minimize on traveling costs and limit fatalities on the road. Again, to justify by taking Kunene in consideration, the kilometers will be minimized as follows. From Korigas to Ochivarongo, it was first 450, now it will be 202 kilometers. From Opuo to Ochivarongo first to Windhoek, it was 733, now it might be 485. From Ocho to Ochivarongo, 70 kilometers. So the difference between all 3 hospitals will be plus minus 248. So that is what one is proposing if the government might build a fully fledged referral hospital in Ochivarongo. Furthermore, I am very disturbed when it comes to quality service. When it comes to quality service that the ministry is supposed to render. I want to share an incident at Ocho District Hospital. On the 9th of March 2025, I took my wife from Korigas to Ocho as she was having a severe pain in the chest. Upon our arrival at the private doctor practice, the doctor immediately requests that we go to the state hospital so that she do a procedure within the theater to determine the cause of the pain. The situation was very serious that the doctor decides that my wife to be rushed to Windhoek to be seen by a cardiologist, and she requests the state ambulance, because requesting private ambulance from Ochivarongo will take time. Even to my surprise, while the doctor was busy with my wife in the theater, the staff members come to inform me about the theater fees, minutes to be paid for her to be in the theater, and the kilometers to be paid in full from Ocho to Windhoek and back, together with other admin costs. I did pay the amount of 3,304, so that the ambulance been released because the seriousness of the of my wife's situation. Now my question to the minister: if any other citizen of this country without any money should have that situation on hand, are we allowing the Namibians to die while waiting for service delivery? Honorable First Chairperson, I wanted to finish, so I.
Can I just sit down and then we see how many members then want to contribute, and then you can conclude. Honorable Guoga. Sorry.
Thank you, First Vice Chairperson of the Committee of the Whole Council. Let me congratulate the Iron Lady, Her Excellency, Comrade Dr. Netumbo Nani Deipa, for appointing a brilliant, a smart lady in this ministry. A gorgeous one. There is no string attached anyway. A young, brilliant lady in the ministry. With that said, Honorable First Chairperson of the Committee of the Council, allow me first and foremost commend the Minister of Finance, Comrade Erika Shafuta, on a timely tabling the appropriated bill. Let me also commend her on her attempt to curb spending and rein in public debt. I should also state that glad that appropriated bill remained in line with the original 3 budget policy pillar, which are pro-sustainable, pro-poor, and pro-growth. Before I comment on the vote, let me congratulate the Minister of Health, Honorable Dr. Esperenzi Lubidao, for being appointed as the chairperson of Committee A at the 78th World Health Assembly. Honorable First Vice Chairperson of the Committee of the Council of Members, our public system, despite being faced with myriad challenges, has proven to be resilient. Our health systems are capable of successfully dealing with difficult situations and challenges. Honorable First Vice Chairperson, all members, it is my honest opinion that despite being the third beneficiary of the public budget after finance and education, health remains underfunded. It is underfunded given the anonymity of the task at hand. The 12 billion appropriation for financial year is inadequate to cover all the needs of the health sectors. Hence, the additional appropriation of 500 million is a welcome consideration by Honorable Minister of Finance. Hence, I will support the additional budget of 300 million appropriation for the purchasing of pharmaceuticals, blood products, and to cater for uncommon diseases to the Ministry of Health. In conclusion, I hope and trust that this budget will cater for construction of health center at Du Plessis, Okorukambe constituency, and the clinic in a Kalahari constituency in Omaheke region, as this plan has been in pipeline for almost 20 years now. And feasibility study was done and delays was on the availability of funds. And this time around, I demand the health center to be constructed in this financial year. And we demand a better district hospital. Our hospital is not up to standard with the current populations in Omaheke. Lastly, my humble request to the Minister of Health in this budget is to consider Maheke region, as we are facing with problems of not having enough ambulances and vehicles to carry out these programs. Challenges with old health facility infrastructure that is no longer adequate to provide services to the growing population. Stock out of some critical pharmaceutical products and medicines and supplies. Limited funds for infrastructure as well as medical equipment maintenance and repairs. Procurement delays hindering services delivery. Lack of retention incentives to attract and keep qualified and skilled health professionals accessible, accommodations, and other amenities. I pray that this budget will talk to these challenges. With this, Honorable First Vice Chairperson of the Committee of the Whole Council of Members, I support the vote. I thank you.
Thank you. Honorable Mavara.
Thank you very much, Honorable First Vice Chairperson of the whole Council. I repeat, Honorable First Vice Chairperson of the whole Council, Honorable members, I stand before you.
We are only left with 5 months, but we can still not pronounce some of these names. Continue, Honorable Mavara.
Today I stand before you to shed light on the matter of profound, significant, and important role played by Health Ministry in the safeguarding the well-being of our citizens. The health of our nation is not only moral imperative but also strategy, investment in the prosperity and productive of our people. At this juncture, please allow me to thank the Swapo-led government through the Ministry of Health and Social Services for their intensive effort, such as Samaturu Clinic commissioned officially on 1 August 2024. Bureau Clinic prefabricated space has been completed and functional. Mabuse relocation prefabricated is under construction. Honorable Chairperson, Honorable Member, in the light above, allow me to draw your attention to the critical challenges faced by hospital in Kavango East. The region has an old fleet with higher male age, which is a result in frequently breaking of vehicles and ambulances. Insufficient health facilities in England, resulting a patient working long distance seeking medical care. There is also limited 4x4 ambulances in the region and also limited space due to the increase of the population. Honorable Chairperson, Honorable Member,
but of sickness with no doctor, distance with no transport, and pain with no one to respond. The rural health crisis. We are facing a silent health emergency in rural Namibia. Our people are falling sick in silence and dying in isolation, but not because help does not exist in this country, but because help cannot reach them. The disparities in healthcare delivery between urban centers and rural areas are vast, growing, and morally unacceptable. Let me outline the most pressing issues. Absence of medical practitioners at clinics. Many rural clinics operate without a single qualified doctor, and in some cases, not even a full-time nurse. Patients, including expectant mothers, the elderly, and children, are often turned away and receive only a basic first aid. The result thereof is there's a delay in treatment of preventable, there's also a preventable death and worsening of chronic conditions. No ambulance. Several clinics and health centers in our region have no operational ambulances. Patients in critical conditions are forced to hire private vehicles they cannot afford, or walk kilometers, often on foot or donkey carts, to get to help. Meanwhile, government ambulances at state hospitals sit parked at district hospitals, unrepaired and unused due to poor maintenance, lack of parts, or bureaucratic red tapes. In some areas, the nearest clinic is over 30 kilometers away, and often through thick sand, flood-prone areas, and unsafe terrain. Honorable First Vice Chairperson, honorable members,
The whole paragraph is an issue. Just address the issue.
Yeah, thank you very much, Honorable First Vice Chairperson of the Committee of the Whole Council. Honorable members, I also briefly touch on the issue of facilities and infrastructure development. Despite being cognizant of the health infrastructure development as a national issue and need and demand, but there are also some evidence that there are regions that are really lacking infrastructures. And there is quite a very huge margin of disparities within the infrastructure developments in the health sector. And that in itself makes it difficult for some of our communities to access healthcare services. Some regions, especially those that are more in rural areas, our communities still travel over 10-kilometer radius and longer to access or to reach the nearest health facilities, which is contrary to the proposal the ministry have made of saying that the health facility should be within a 10-kilometer radius. Tawango West is not an exception on this. Despite listing certain developments within the minister's motivation speech, like the completion of Garuhwa Clinic, as well as the establishment of the ICU at Nankudu Hospital, which is quite commendable, Kavango West need a special attention on infrastructures, such as the suggested Kurenkuru District Hospital. Groundbreaking was made in 2014, but to date, I think there is nothing on the ground. I remember listening to the speech of His Excellency, the second Vice President of our country, who even made the groundbreaking by then last week during the gala dinner at Kurenkuru Expo, where he said at least what he wants to see is that the construction should start now. It has been long overdue. The region, it was a priority of the region, and it was also a priority nationally. So we have to honor that obligation. With that said, Honorable First Vice Chairperson of the Committee of the Whole Council of the members, I support the vote and I so submit. Thank you.
Thank you. Maybe before I give the two honorable members who did not conclude, any further discussion? So we have Honorable Dembele, Honorable Abraham, Honorable Kuoko, Honorable Lukaesi, and then Honorable Mungindi. The others, Honorable Kops and Ukura, I will then give you after I may have exhausted the other members. Honorable Dembele? Honorable Dembele? After you drink your water.
Dumelang. Ga te botsoga ha bona le sephiri batho ba shwaela setso ba shebile. I think we Honorable Kambrute has made it very clear that mother tongues should not be taken into consideration. So for me to translate that is no need. Honorable First Vice Chairperson of the Committee of the Whole Council, honorable members, allow me also to congratulate the newly appointed Minister of Health and Social Services, Dr. Experience Livindao. Yes. Indeed, the name Esperanza has become Esperanza and Experiency. The district hospital, honorable members in Gobabes, is in a deteriorating condition and service delays. So the alarming state of Gobabes hospital is severely impacting the quality of care and patient well-being. It has been observed that many patients are being forced to sleep on the floor due to inadequate facilities and overcrowding, as Honorable Goova has already alluded. So this situation not only compromises patients' dignity, but also heighten the risk of infections and other health hazards. Additionally, there are significant delays in hospital services with long queues and prolonged waiting times for consultation, treatment, and diagnostics, which undermine the efficiency and the effectiveness of our healthcare delivery. These conditions are unacceptable and demand immediate intervention. 3 months ago, we have a case of a young VTC student who was asthmatic and came to the hospital just to come and request for that asthmatic pump or a device or an inhaler, just to ask for that thing. And really it went to the delay, and he went to the nurse trying to explain, but the situation was so critical that it was ignored and then later passed on, which is very sad. So that's why we are saying these conditions are so unacceptable and demand immediate intervention. Addressing this issue will not only improve patient care, but also restore public confidence in our health system. Therefore, urge the Office of the Minister to prioritize this matter by allocating resources for hospital infrastructure upgrades, increasing staffing levels, and implementing measures to streamline service delivery. Allow
Those
area prone to malaria. And then now malaria disease started threatening the health of the Namibian people. Me to the minister just to make sure that enough medicine for malaria it is purchased for the Namibian people, including the testing kit, so that at the end of the day, all people who are affected by the malaria in those areas get a better treatment. Number two, on the malaria again, those areas there's annually spraying for malaria. So as at the ministry, maybe these types of exercise to start earlier, because before that malaria is continue threatening the people. And this year it's not going to be sprayed only those areas where malaria cases are recorded, but the whole region where is prone to malaria, especially then far north and northeast. All those areas, malaria, it is threatening the livelihood of the Namibian. With that, so I submit, Honorable Chairperson.
Thank you, Honorable Abraham. Honorable Woko.
Yeah, thank you, Honorable First Vice Chairperson of the Committee of the World Council for the opportunity, and a very good afternoon, Honorable members. Yes, mine just on this vote of health, one of the very important ones because it's talking of the health of the people. A country without the health people is not a country in a good hand. To see to the location of 12.3 billion, it sounds enough money, and I just have to advise or to request the minister responsible for this important ministry that to have to look to the purchasing or acquiring of the medicine. This is Honorable Abraham just said now that if the medicine is available within the country, the people will be healthier. And the other thing is also that these people, when a person is sick, you have to transport it. So I'm requesting also the ministry to think of purchasing enough ambulances for the countrywide, because it's in everywhere, wherever you hear from, it's in every region, you hear that there's lack of transport to take our sick people to the health centers or clinics. So to have transport, it will be a better way of doing things for this ministry, because have been in our outcry since then, and there is no. That's why people, you can hear that sometimes you can hear that people are passing on while to reach the next health facility. And also to my surprise to hear that there is also some charges which really I am not foresee that a state hospital or maybe a state clinic to charge such an amount of money. Not everyone having enough money to pay such amount. So ambulances is needed. And also to recruit doctors. We know that sometimes people, they are in the queue to wait a doctor to finish somewhere and to come to the next health center or clinic. If we have enough doctors, our people will be treated on time and will not lose lives. And the other thing is that even staff, nurses, we have lack of nurses. That's why today I don't know what happened with the Ministry of Health and Social Services, that they are not having their own training centers. Now we are just depending on this institution around here. Everywhere, each town you find another institution. Maybe is thinking of maybe to have enough nurses, but in reality, when you come to the hospitals, there is still a lack of those staff members or nurses. So the recruit suggest that the minister has to look in that one. All these clinics and hospitals, at least to have enough nurses. And the other thing is that also the outstanding projects, some of the projects are on hold. For example, we're having a clinic at the Pupa Force there for 7 years. This time is another contract is given that to work. After a few months, the contract leave incomplete, that project. Another one is appointed, but another one is paid. So I think this one we are just busy. The ministry is just busy being drained or give the money away while the projects are not completed. So, Honorable First Vice Chairperson and Honorable Members, I think really in our regions and constituency we have such uncompleted projects. The minister and the ministry have to be approached with such a big money so that they can finish those. People not to travel long distances to seek for assistance. So the other thing is that also I'm coming from Kunene, whereby there is a vast region and constituency, so that at least this community health extension or nurses, or how to call them, to be recruited. It was a very nice program, a very good program, which some of those people, if they are sick in their villages, they can be assisted just direct from there. But now as I'm speaking, very few who are there. Yeah, maybe I'll come back again because I'm not finished. Thank you.
Thank you. Honorable Lugasi.
Thank you, Honorable First Vice Chairperson of the Committee of the Whole Council, honorable members. I rise to contribute to the debate on vote 13, health and social welfare. I rise to support this important vote while highlighting both of the achievements and ongoing challenge in the Zambezi region, which I represent. Let me begin by commending the Ministry of Health and Social Services for their progress made this year, starting last year, on our healthy care system in Zambezi. One of the notable achievements in the Zambezi region is the recruitment of staff members. As we are aware that we have a serious challenge before on the recruitment of members, but this year in April, we achieved that, and I hope it's an achievable, which I can call now. 114 nurses started resumed duties on the 1st of April, the first week of April. 140 nurses. Among those nurses, 78 were enrolled nurse, 62 registered nurse, 3 emergency care practitioners. You understand? 9 doctors.
You are protected, honorable member.
9 doctors. So it's really a great achievement. Therefore, and also I would like to congratulate the former minister, our grandpa, Honorable Karumbi Shangula, who left and made the floor level that when he ended his term, the last month March, he was in Zambezi to go and check some of the projects which have challenges and some achievements. And the new minister also, when he started, I hope when she started, she went to Zambezi and she said, it's my first time to be here. So I deliberately come here to come and see what you are going through. The distance people were talking, and then you can see the commitment that the continuation, I believe it will continue. Therefore, my humble request now on challenges is Zambezi have 1 district hospital, 3 health centers, 30 clinics, and some mobile clinics. Therefore, my humble request is through these 9 doctors, Bukalo have already received 1. Bukalo is a health center. Sibinda, we are promised among them, and Sangwali. So my plea is for the ministry or the minister to speed up the remaining 1, because we are waiting. We have already arranged for accommodation for those doctors. And as the Honorable Kennedy Masiku yesterday mentioned in his maiden speech, that the issue are a lot, and we need to work together and make sure that some of those challenges are sorted. Especially, we have the challenge of community health workers. When they resigned or retire, they are not replaced on time. And then that there will be a vacuum on that community. So we request that once one leave, the replacement should be done on time so that our community are well served. And also, I humbly request that there are mobile clinics which were constructed at Masida and the Makanga in the Linyanti constituency. These mobile containers are underutilized. We therefore call the ministry to budget in this budget that this mobile, either they are visited once or twice in order to alleviate the people going from one health center which is going to be congested. With these few words, I'm always on time because I don't make good morning. The chairperson or the first chairperson have already done that. So I thank you. I support the vote.
Thank you. Honorable Amujindi.
Yeah, thank you very much, Honorable Vice Chairperson of the Committee of the Whole Council, Honorable Member. I just want to make a very short contribution to the Minister of Health. Mostly, I just want to zoom that I want the newly appointed minister to consider with this budget. They have been overdue outstanding referral hospital that's supposed to be constructed in Oshana region, in Ondamba town. The red has been allocated. And it was in NTEF. And sometimes it vanished from the NTEF. We want to see the start of construction of referral hospital in Oshana, Ondamba town, where the rent is already allocated. That will cater most of the region as it was alluded when it was there, like Msati, Oshana, Oshikoto, Hangwena, or Kavango West, even Kunene region. Yes, they can be saved there. And they also cut the kilometer that the Honorable was speaking about, comparing to Ochiwarongo, which is very far. Honorable, from where you know, Honorable Member, again, there is also another issue. There is also another issue that needs to be addressed. Uvudia in Oshana is one of the remotest area, constituency, which does not have a clinic. And most of the farmers, they are grazing in Uvudia area. And the snake bites are very high in that area, but there is no clinics in Uvudia. We want to see a construction of a clinic in Uvudia constituency so that people will be easily access to health services. Even this year during the flood, government spent a lot of money to lift people to access health services in Oshakati, using the police helicopters and also to use the NDF helicopters, chopper, so to say. So, and even if it's not during the rain season, community member in those areas, they are spending a lot of money to come to Oshakati Hospital. Traveling 8 kilometers, coming to Oshakati, and 8 kilometers going back. That's 106 per day. So therefore, we need the construction of that clinic. And if there is a hindrance of police, or the police of the police of the Ministry of Health, that needs to be changed. Finally, Honorable First Vice Chairperson of the Committee of the Whole Council, Honorable Member, I want to see the minister to consider to upgrade these 2 clinics into a health centers. Ukuyu Clinic, because it's also catering Ukuyu and the Okachari, and most of the cattle posts, they are also using that clinic. But when they have they experience a snake bites afternoon, the clinics always closed at 5. They have to go to either Oshakati, they have to go either to go to hospital to Oranjokwe. Once we have a health center,
Honorable Gobs, speak. True.
He's confused. Ah. Yes. So, Honorable Chairperson, one is Ukuyu Clinic and also one is Eheke Clinic. Because Eheke Clinic also serving some part of Ukuyu Shona, Ompuja, Oshakati East, they are served at Eheke Clinic. And it needs to be upgraded into a health center so that you can bring service close to the people, because at the health center, there will be doctor every day and they can work 24/7 around the clock. With this few contribution, I so submit, Honorable First Vice Chairperson of the Committee of the whole Council, Honorable Member, I support the vote. Thank you very much.
Thank you. Any further discussion? Any further discussion? Honorable Jambula?
Thank you, Comrade First Chairperson of the Committee of the whole House, or members. I also like just to make my contribution towards vote to 13. In the first place, the staff of this ministry need attitude change for the betterment of our people. Furthermore, I'm calling upon the ministry to seriously consider the upgrading of Orukonda and Ontananga Clinic to a health center. And this should include, among others, staff accommodation. Staff who are working at this clinic, they are from far away, 15 to 20 distance. Equally, these two clinics are in a dilapidated condition, and they have got a lot of cracks, which need serious but urgent attention. Therefore, the ministry should seriously consider this agreement. And the population of Orukonda has also increased from 15,000 to 20,000 according to the last census. Furthermore, the ministry should also consider supplying mosquito nets to the people, because mosquito net will create havoc this year. With this few remarks on the chair, I support the vote and thank you.
Thank you. Honorable members, I think I can now go to the three honorable that were not done with their contribution, but I will give you 2 minutes just to round up each, starting with Honorable Cobbs. Please, 2 minutes just to round up.
Oh, no, not stories. Thank you again for the opportunity. As I already alluded, honorable members, I did pose a question to the minister if a Namibian citizen without money was having this kind of a scenario, must we allow the Namibians to die? The other issue is, I'm of the opinion that the officials should have released the ambulance, and while my wife was en route or on road to Windhoek to make arrangements with me for the payments, but the official blindly decided that the ambulance will only move if payment is not done or is done. I must inform this house that the cardiologist informed my wife that she was very likely to reach Windhoek alive from Korekas, as her heart were blocked by blood on 3 areas. This kind of bad services by some officials at some health facilities cannot be tolerated, as this will allow that we will lose our beloved people. As at the very same hospital, I was on the last Sunday, I was seated quite at the casualty to observe the service delivery to the patients, and I could see that there were maybe only 1 or 2 nurses, to the extent that the porter has to assist with the screening of the patients which were in a very long queue. So one must also advise that the hospital deploy more nurses at casualty during weekends and public holidays so that the patients being attended timeously, not to sit and wait in long queues. The toilets within the facilities are not working, toilets are not flushing, the wash bins to wash your hands are also not working. So in case of
Thank you.
how we delivering services, so I submit.
Yeah, thank you very much. I was by that time I was saying that we need enough or more community health workers, at least to assist our. First Vice Chairperson, I'm requesting the ministry to, whenever they are acquiring materials or anything for the ministry, they have to use direct procurement. Because if they use this process, procurement system as it is delay service delivery. So direct procurement, I'm requesting the ministry to look in that one and to go for that one so that our service delivery can be on time to our citizens. With those few, I thank you, Honorable First Vice Chairperson.
Thank you, Honorable Hukura. 2 minutes.
Thank you, First
It was
Vice
just a
Chairperson
follow-up.
of the Committee of the
Like
Whole
Nanas.
House. Allow me just to conclude. I was saying on recommendations, I wanted to recommend that the government upgrade the rural clinics into health centers to increase the number of health personnel, also including doctors.
There's a point of order from the brother.
Yeah, thank you very much, Honorable Member.
Honorable Hukura, can you switch off? Honorable.
Yeah, we felt it's only that we need to direct our honorables. I'm standing on Rule 68 there.
Sub-rule what?
68 subsection 2.
Sub-rule?
Privilege. Honorable, when you present in the National Council, can you please remove that green thing on the neck? Because we were told that is for the recording purposes. Please, I so submit.
Honorable Hukura, can you conclude, please?
Honorable Vice Chairperson of the Committee of the Whole House, let me just pose a question whether this bullying is allowed and until when.
You are protected, just continue. I think you were just directed.
Secondly, I wanted to also recommend for the construction of a referral hospital in Ochiwarongo, in the Chironjipa region, because the land was already donated by the municipality of Ochiwarongo to the Ministry of Health. So, and just to conclude, I wanted to say the measure of a nation is not in the strength of its economy or in size of its cities, but in how it treats its most vulnerable. If our rural people are neglected, then our development is incomplete. This House, this Parliament, must speak with one voice. The health is not a privilege, but a right. That a mother giving birth in a remote village should be just as safe as the one in Windhoek. That a sick child in a rural area should be seen by a doctor and not buried because one never came. Let us act, let us lead, and let us deliver. And so I submit. Thank you, Honorable Chair.
Thank you very much. Honorable Gambrute.
Thank you, Honorable First Vice Chairperson of the Committee of the Whole Council.
I think you have 5 minutes because you did not speak. Okay.
Yeah, I haven't spoken before. Honorable First Vice Chairperson, honorable members, according to the Constitution, Article 102, the Regional Council is regarded as the principal governing body in the region. I have listened to all the honorables speaking, and everything was really valuable because we do have problems with regards to health. But I am of the opinion that we should not only expect of the central government and our newly appointed minister to solve these problems. What is wrong, or let me say, I don't think there's anything wrong if we as the Regional Council approach the Regional Health Director and say, let's sit down and see what are your plans for our region, what are you planning to put up in our region. Since we in the constituencies, these are the challenges that our people bring to us with regards to health. I think that will help.
There's somebody who want to help. Honorable Gindi, you are standing on.
Rule 68, sub-rule 6. The honorable member said the honorable member who contributed, they only asked the honorable newly appointed minister. And they don't want the honorable member to ask or to present their needs to the honorable minister. My question to the honorable member, when did he was appointed to become a spokesperson of the minister?
Thank you. Honorable Gambrute, the floor is yours. Do you want to reply?
No, Honorable First Vice Chair, I am not going to reply. You see,
you can continue.
Even when a minister visits an area.
Are you now replying?
No, Honorable Chair, I'm continuing with what I was saying. Even when a minister visits an area, and some of the people or the inhabitants of that area would address him quickly or quickly come to the minister and say, we have this and this problem, the minister would say, go to your councillor. That is what is done. So I think it would be good if we as regional councils could go to the health directors and discuss with them the health issues, all the challenges that we come to know from the inhabitants of our constituencies, obviously making up the region. So that then the Director of Health can also tell us what their plans are. I have done that in my personal capacity as the Constituency Councillor for Rehoboth Urban West. I have approached the Director of Health, and that resulted into a 2-room health outreach point being put up in my constituency. So I'm talking out of experience that once we do that, instead of just leaving, you see, we have got 121 constituencies. And although I'm not the spokesperson of the minister, I think it would be unfair to expect the minister to go to each and every constituency. It will take her more than 5 years to go to each and every constituency to concern. What we can do is make our reports as we find it, compile it properly, discuss it with the Director of Health, and say, listen, can you then have, or can you arrange for an appointment, us together, to go and see the minister? And then, instead of the minister going to each constituency, The minister may only go to a region. We come together, we discuss the problems that we have, we see how we can assist each other. I've done the same with the police. I went to the police and said, this is the problem that we're having. And now, this year, we have already on 24th of April, we already had the first site visit. We are going to build a police station. I'm sharing with you my experiences in my constituency in how it assisted me in bringing services to our people. So instead of just bringing the problems or challenges that we have, which is not wrong, let's from our side also do something and approach the health directorate and the health ministry and see how we can help in solving the health problems that we're having. I so submit, Honorable First Vice Chairperson, supporting the vote.
Thank you, Honorable. Any further discussion? Any objection? I see none. Agreed to. I shall now put vote 14, labor relations, with an amount of 250,256,000 Namibian dollars. Any discussion? Honorable Goauga, Honorable Abraham. In that order. Order, can we have order in the house, please? Yeah. Honorable Abraham, you are coming after Honorable Goauga. Oh.
Thank you, First Vice Chairperson of the Committee of the Whole Council. Thank you. I would like to contribute to this vote 14. And before I do that, let me once again congratulate the Minister of Justice and Labor, Honorable Philemon Wise Emmanuel, for the job well done by reinstating over 200 Namibian fishermen back to work. For those that did not listen, I'm saying that for reinstating over 200 fishermen back to work, that's a good job. And that was now long overdue. It's because of his wise intervention that has led to the success of negotiations, and this was long overdue. Now we proudly say that the family can finally breathe a sign of relief. Honorable First Vice Chairperson, honorable members, the regional appropriation budget of 250,256,000, this is not enough for the ministry to carry out their mandate. And I call upon an increase on this budget. It's not enough for the ministry, yes. It's a vast ministry, Ministry of Labor. I have my reason why I'm saying that. Labor inspectors are not visible on the ground. Cases are not being prolonged due to shortage of labor commissioners that are presiding over labor matters. Honorable First Vice Chairperson of members, allow me to tender my dissatisfaction and disappointment on Ministry of Labor Relations with their labor inspectors and their regional office. Workers are being unfairly treated in the hands of their employers, and they are not getting any assistance from your ministry, Comrade Minister. White farmers are mistreating farm workers. This is not a secret at all. And they have that audacity of writing letter to the minister to stop regional councillors not to involve in labor matters. It's high time, honorable members, that the Labor Act number 11 of 2007 to be revisited. Honorable First Vice Chairperson, I have a case that is coming from November last year, whereby a farm worker was now dismissed from the farm. And we approached the labor inspectors. Up to date, that case has not been attended to. This labor inspector never went even to listen and to see what happens. And this person, these farm workers, is now on the corridor from November up to now. He's just grazing on the corridors. He was even evicted from the farm. So, and this labor inspector, I can even tell the minister that they are failing his ministry. And he need to act on that one. And the same case that is happening now 3 days back. One of the farm workers was assaulted. And he was beaten until he was now vomiting blood. He went up to the hospital in Kobapes. But up to today, as I'm speaking, the labor inspector did not even attend to that. So this is the farm workers, the issue that they are facing with our labor inspectors. Another challenges farm workers are facing, they are denied to benefit from the drought relief programs by their white employers. And the reason here too is that they are not benefiting from this program. They will not buy, if they happen to benefit from the program of the drought relief, they are not going to buy food from their shops. So the commercial farmers, their gates have been closed so that the people cannot take this food to these people to benefit from, because they want them to buy from their shops. Honorable First Vice Chairperson or members of the Committee of the Whole Council, given these considerations as proposed by the Minister of Finance, I advise the Minister of Labor Relations to employ more labor inspectors in the regions because employees are being mistreated at the hands of employers. And there are huge unfair labor practice happening, especially in commercial farms. And cases are taken long at labor commissions, and this must be now rectified. With that, I submit and I support the vote. Thank you.
Thank you, Honorable Abraham. Switch on your mic.
Thank you very much, Honorable First Vice Chairperson, the whole committee of the whole council. Mine, I want also to contribute to such a vote 14, labor relations. Honorable Vice Chairperson, Namibia continues suffer and exploited on the hand of foreign business people, especially those who are working either in a store, in a shop, or in a warehouse of the foreigners. They are suffering, true speaking. They are paid peanuts. They are working the wrong hours without any overtime. They are working on Sunday and holiday, and also public holiday. They are still continue working. Honorable Vice Chairperson, if you travel all our towns during the public holiday, now public holiday now for only government employees, not the other people. When we commemorate 1st May in Oshana, our head of state was there, and the whole either building, either China's warehouse is open as usual. So Namibia are not allowed to attend such a very important day, to addressed by the head of state. They are kept working in such a public holiday. Then warehouse, building, and whatever, it's not essential. They're not selling food, which is needed daily. They're supposed to close like other outlets. But while the Namibian outlets, those small businesses, they are forced to close. That is a public holiday, you cannot be open, you cannot open. While the big ShopRite and what others, they are open in a public holiday. If your memory serves me well, when we were mourning the founding father of this country, when we buried the founding father of this country, the whole window is open as usual. That's now we are happy that labor relations under the Minister of Justice. Then I humbly request the Minister to amend the law. Because those foreigner businesses, if something is happening to their country of origins, either Independence Day, either a very important holiday in their country of origin, they are closed. They have closed their businesses. Either when they go to their churches, they have closed their business. But when Namibians, it's a holiday in Namibians, it's a very important day in Namibians, their business is open. That's why I now humbly request the Minister of Justice to amend the law. This is a raw country, so that those foreigners, they can follow the law. They can amend, including the penalty, that if they found their business open during a public holiday, during whatever, they must pay a certain penalty, or either they put them in jail, because it's not allowed. Namibia, they want maybe to give a respect to their leaders, they are prevented to do so. To attend other very important events, they are prevented to do so. They are always businesses open as usual. Such a thing should take us anywhere, honorable members. With that, so I submit.
Thank you. Any further discussion? Honorable Gambrute and then Honorable Hukura.
Thank you, Honorable First Vice Chairperson of the Committee of the Whole Council. I'd rise to just make a small contribution on the issue of on the vote of Labour. I would like to support Honorable Nguwawa in his concern on how some employers treat employees. Some of the employers in this country abuse the situation as to where employees is ignorant with regards to the law. Some employers, they have on retainer contract highly qualified labor experts that serves their interests, but would never come to the place of work and explain the conditions of employment to the employees. They work for the benefit of the employer only, which you cannot deny because it's an agreement between the labor consultant and the company. There I take offense when it comes to our labor inspectors. You will never find a labor inspector that will walk into a place of work, take out his identification card and said, Mr. Busiu, I am Harold Kambrudi from the Ministry of Labor. I came to pay you a visit. I'll give you 10 minutes to quickly finish what you're busy with, then I'm talking to you. They don't do that. And it is their full right. No employer can ever refuse a labor inspector to go or enter his or her place of work unannounced. They walk in there and say, listen, I come and I want to talk to you about this and I want to talk to you about that. I know what I'm talking about because I'm a qualified and highly experienced labor practitioner myself. We have a situation. Yeah, I can show you my credentials, Honorable, through the Chair, Honorable Tabeli, if you doubt that. You see, if you look at Chapter 3 of the Labor Act, especially Part 1, and you look at Section 12, kindly check it up. Section 12, subsection 5, paragraph B1. It is very, very clear that an employer shall not require from an employee to buy goods from his shop. And some employers, especially in the farming community, they force people to buy at their places of work. And not only the farming community. You find other employers who run shops. They also expect people to buy from them or require from them. The law says it shall not be done. I'll quote it again. Chapter 3, Part A, Section 12, Subsection 5, Paragraph B1. Go and read it, and you will see it. It is there. Lastly, since most of our employees are ignorant of the law, sometimes when they are dismissed or taken through disciplinary hearings, they do not have a clue on how to present or represent themselves. Many people come to me. Then I tell them, unfortunately, I cannot help you because I'm a lawmaker. I cannot now go and apply the law. I'm a lawmaker. So I cannot help you. I can send you to somebody else. And people are taken through disciplinary hearings and fired from things that's not even necessary, things that would require a warning, final warning, or something like that. Then people are dismissed. Then they also don't know how much time they have to go to the Ministry of Labor to go and report, what we call it, you refer the incident to the Ministry of Labor. There's a specific time in which you should refer certain events at your work or your workplace. And if it is done after that time, it is then called that case has now prescribed, and it means that the employee does not have a case anymore. So the labor inspectors, I call on them, go to the different places of employment, talk to the employers and the employees, and try and get to the place where employees are informed also about the rights, because many employers does not do that. Honorable Chairperson, First Vice Chairperson, with these few remarks, I support the vote. Thank you.
Thank you. Honorable Hukura. Honorable Brute, can you switch off?
Honorable Vice Chairperson of the Committee of the Whole House, I rise.
Please, the Honorable is protected.
Make my contribution on this vote. I want to quote from our Constitution before I do my submission, and I go to Article 8 of the Constitution, sub-article 2 and paragraph B, and I shall quote, "No person shall be subject to torture or to cruelty, inhuman or degrading treatment or punishment," unquote. Now, Honorable Vice Chairperson of the Committee of the Whole Council, I rise here to share with this House an incident that happened last week in my constituency, where a worker was brutally treated by a company hired by the employer, whom they suspected that he had stolen from the employer, and he was brutally beaten. He was beaten, and he landed in a hospital in Kobaves in a very bad state. For 3 days, he did not even speak a word. So now, why I quote that article is because when we suspect something, I think the law is very clear here, that the matter be reported to the police, and this suspect then be taken through the courts of this country, and a proper judgment is delivered. So now there are these Namibians who really think they are maybe bigger than the law, and they take the law by their own hands and they beat people up. I wanted the ministry, or I propose that a proper awareness is being made so as to improve labor relations by the ministry. They go around farm by farm and they make awareness that these farm owners so that they improve on labor relations. I so submit, Honorable Vice Chairperson, to the
Thank you, Honorable
Committee
Kura.
of the Whole Council. Thank you.
Thank you. Any further discussions? You want NAMCO? Okay. Honorable Goga?
Yes, please. Thank you, First Vice Chairperson of the Committee of the Council. Mani, just to supplement what my Honorable Kabrute have said. But before I do that, I want to tell Honorable Hugura that all the Namibians they know what the law says. And especially those that are the employees, they know what the law says. It's just that they are doing it on purpose of saying that this government will not do anything. They are even saying that, go and call that labor inspector, they will don't do me nothing. Go call that police officer, they will do me nothing. But they are aware of the law. What I would like to supplement what Honorable Kamrute have said is that, especially when it comes to the farm workers, our people are illiterate. They are illiterate, and they are a distance from towns to go and register cases. And just that moment that they get that time to go to town and register those cases, there is a form that they are filling it in. And they are leaving that form at the office to register the case. These staff members of the ministry themselves, even to go through the forms and to see whether it was now already completed or whatever, they are not doing that. But after 2 months, they are calling the person who say that come back and can fill the form, you fill it wrongly. And even if that farm workers try to ask an assistant from the staff members, say, can you assist me? How should I fill it in here? They are not assisting. They are saying that the law prohibited them. They cannot assist the person to register a case. What is that? So I call upon the minister to revisit this labor act or even to talk to their staff members on this matter.
But what does the law say? Should they assist or not? You are a labor inspector. Okay. Just for clarity, because we only want to know, because all of us must are then going through the same problem. Any further discussions? Any objection? I see none. Agreed to? I shall now put vote 18. Environment, Forestry and Tourism, with an amount of 797,626,000 Namibian dollars. Any discussion? Honorable Gunaye, Honorable Simashuku will follow after you.
Yeah, thank you very much, First Vice Chairperson of the Committee of the World Council. Honorable members, I want to take part in this vote 18 of Environment, Forestry and Tourism. And this is a very important ministry to our country in terms of protecting our ecosystem, so that proudly we can invite any person, anybody around the globe to come and visit and see the beauty of our republic. But when it comes to conflict between human and wildlife, conflict there, the ministry and other stakeholders, they are not doing much to protect human. Elephant, they are destroying human properties. If you check through the policy on compensation, the garden that need to be compensated should have been, or should be 1 hectare. Should be a 1 hectare. Now, if you look to Kunene, because the nature of the environment, mountainous area, rocky area, and having a very much surrounded by deep rivers, it's very much difficult to find one person
having a garden of 1 hectare. Because the plain area that is available, all the communities, they have to divide that small portion of land. But now in terms of getting something in return, if their properties destroyed by elephant, they cannot benefit because their garden is less than 1 hectare. That is a very, 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 very unfair. And then when you come to livestock killed by predators, the money given to the farmers, it doesn't even help farmers to restock what they have lost because of these wild animals. At least we need an increasement so that money will help farmers to restock what they have lost from wild animals. And my plea to the ministry also is regarding these Walden, or how you call these staff members who are dealing with these animals. There was, I want to use an example of 2 staff members who were attacked by lions in Casablanca in Oshikoto region. I think that those people, they need to be given a danger allowance. Because these people are working every day, working with those dangerous animals. Now it's not only animals that they have to deal with. Now those illegal poachers also, they are there hunting for these people. Therefore, I'm requesting the ministry to look into these matters as a matter of urgency to give these people danger allowance. And this year, we have received a very good rain, and everywhere there is a lot of grass. As much as we are sensitizing the community to be very much careful with the fire around their surrounding, also I'm pleading to the ministry to put everything in place so that they can assist the community when there is a fire outbreak. Because otherwise, our nature will be destroyed if there is no proper equipment to assist the community. Because most of the time, when you are calling the ministry, they said, no, we don't have car, we don't have fuels to go and assist the community. And with that also, I want to comment, I want to thank our Regional Commander Commission, Derula, who always avail men and women in uniforms to assist wherever we need assistance to when the fire outbreak happen in most of our villages. Therefore, I want to request all honorable members, all leaders, to talk to our people to be very much careful when even sending their kids to go and collect fire from the neighbor. To be very much, because if the fire starts from Windhoek, it will reach Kunene, because we have a lot of grass this year. And also the ministry must consider a separate budget to help the community to put up a cut lines. Otherwise, we will be in trouble. With this few remarks, I support the vote. Thank you very much.
Thank you. You will cover your 5 minutes, maybe being so close to the display hour there. Honorable Simasiku.
Thank you very much, first Vice Chairperson of the Committee of the whole Council. I rise to contribute to vote 18, and equally, before I give my input, wish to support the vote, and also in the same vein, register my appreciation to the government of the day, a very caring government, for availing funds to ensure that the government is run properly. I have 2 observations to make in this respect to the relevant ministry. The first one is about conservancies. There is a standing arrangement with most conservancies. And by the way, these conservancies have the potential to contribute significantly to community development. Take, for example, one elephant. The arrangement that is now here, which I call a mafia, is that the conservancy will sell an elephant to a middleman. Say, for example, for 200,000. The middleman will then look for trophy hunters somewhere in Europe. The Cambrodes. And this professional hunter will end up buying the same elephant for more than 1.2 million or even close to 2 million. The Conservancy only gets 200,000, and that 200,000 is then distributed maybe to some villages, in sort of projects and stuff like that. The middleman goes home, buys Land Cruisers and what in the process. I implore the Ministry of Environment to re-look into this area. I do not know why there is this obsession in this country with having a middleman for everything. Why can't conservancies themselves look for trophy hunters? What is the problem? Why can't they go to some people in Germany or America or wherever and say, look, this is our quota given by the ministry to us to sell. And so we need you to buy, come and or kill, because it looks like you guys are obsessed with killing animals here. Come here and shoot so that you can be seen to be a man, and then give us 2 million. These conservancies are able to construct clinics, to buy transformers, to construct community hostels by themselves to the communities where these conservancies are based. It's disheartening. And by the way, in some conservancies in the Zambezi region, the middlemen are unfortunately from the previously advantaged communities. And they sit there in the bush. You don't see them in town because there's money there. So I'm pleading with the ministry to please relook at this thing, revise the policy if necessary. Let's empower communities. If we can't do it, who will do it for us? The second observation, Honorable First Vice Chairperson, is on the Nature Conservation Ordinance 4 of 1975. 1975, honorable members. That is the audience that the Ministry of Environment is using in terms of wildlife protection. 1975. Obviously, we have amended it. The fact that we have amended it more than twice or 3 times, it shows there's a problem. What is stopping? Law reform and development commission. I implore the relevant committee on constitutional affairs, legal and constitutional affairs. At some point, you need to call law reform and say, look, some of these laws that are as old as our grandfathers, they need to be scrapped off. Honorable members, if you see members of our white community lining up at an office, there is money there. Just go and find out. I swear, there is money there. I witnessed, I saw it. My goodness, my time is up. I saw it with the Minister of Finance because there's VAT refunds. Minister of Environment, trophy hunting. Thank you very much, Honorable First Vice Chairperson.
Thank you. Any further discussions? Honorable Lugasi and Honorable Goko.
Honorable First Vice Chairperson of the Committee of the Whole Council, honorable members, I rise to make my contribution, but I'll be short on this vote 18, environment, forestry, and tourism. First, I will just go on the issues of wildlife conflict. When we were in the Sona, my area was severely affected by the roaming elephants. And when I was talking to Honorable Gunaye, he said it's the same also in Nene. And what we observe, these elephants, they are not ours. They are migrating from Angola or Botswana. He also said theirs, they don't have the rough foots because they are in rocks. Ours also we can see. And these elephants, they have different characteristics because they are new in the area. They could go where the people are and chase them at night. and then I have to call the ED, the minister at night, because people think I'm the one in charge of environment. So midnight, I have to wake, call, we're talking with the director, with who
So
at
you are
night.
the middleman.
So there was no response. People have to shift from their homes. Therefore, I called the ministry to make sure that they put a center, because there's already a directorate of forestry at Sibinda. It's an office, but now environment when it's not there. Therefore, they have all vehicles and so on. So we want during plowing, at least they should send someone to their office so that he assists us, because we don't have a conservancy. Secondly, I just want to go to the issue of the gazetted forestry, state forestry in 2023, which is now a conflict by the community, because the community, they are not aware. Even me, the councillor nearby, because that community is the area remained to the user are from Sibinda constituency. The land is in Kongola under Honorable Sihu, but the user is in Sibinda constituency. So when they were consulting, they did not consult the use of the land. So they just realized that their land is gazetted. But they say it was gazetted before independence, so it was just a name, and then the law says the area which were called state forest, they should continue like that. So there was no consultation, but according to what we know, it was the war that shifted the people from that area inside. All those who fought at Kamenga, all those who are veterans today, they know that it was their war zone. And even now, they're still clearing the landmines and others. The armies were there when they are clearing the border. So now we are told a state forest before the area has been cleared from landmines. So people are appealing for the government to make sure that they relook or they consult the rightful owner of the land. The other issue is on how the compensation, how they measure the hectares. Like he said, if it's a garden, you know, our garden is almost not 1 hectare. They say they don't pay gardens. And if it's a land, a 1 hectare, the way they measure, they don't measure the whole hectare affected. They will follow with the measuring wheel. They will follow where the elephant was, and then they are measuring like that. This is where the elephant. I follow them. They will just follow like that, and then they will turn. And then after 2 hectares, they will say, this is not a hectare. And then farmers called me to go and observe. I went there. Then they told, no, this is how the law is. This is how the policy is. It's up to the lawmaker to make sure that they amend this policy. Otherwise, our farmers, when they're affected, they are not going to get anything because of the measuring system, which the policy is. And the one implementing, enforcing the policy, they cannot divert from it. So I'm appealing that the technical committee involved, they should look into this measuring policy. It's really, I didn't comment, I was just observing that even the one implementing is just, he can't comment because he's afraid, because people report him, but it's not really fair the way they measure. With these few words, I support the vote. I thank you.
Thank you. Honorable Gogo.
Yeah, thank you very much, Honorable First Vice Chairperson, Committee of the World Council, and this vote 18, the environment, forestry, and tourism. Yeah, the money which is allocated, it's enough a bit to procure transport, to have enough cars, because as we all the previous speakers here, they are talking about lack of transport. So such a ministry which is dealing with wildlife, with people's conflict, it needs transport to react on time. So if they do not have transport, how they are going to attend to the cases or to the problems is reported. So I'm requesting some of this money here have to be used to procure enough cars or vehicles so that at least this ministry to attend to the reports or to the problems. Because now, like in our region there, as I'm speaking now, let me say the whole month as it started. Every day we receive a report from the community, but we used to be informed and told by those officials that first and foremost, our movement is controlled from the head office. It's meaning Windhoek. We used to be located fuel, which is not enough. And we do not have any transport. If it is only one, it is going for service, it's gone. Reports of elephants within the area of Ominyange, Ombago there. During the break, I was called 2 times. They are there, those crops fields and closer to the houses. But there is no transport, a car to go and chase or whatever, how they used to do with such elephants. Today, we leave it like that, but tomorrow is killing someone. But there is enough money here to procure cars. And if some of those cars, even we used to hear that only battery, it's lacking of a battery to put the battery on, small repairs. So if there is not petty case to have, let's use this money to have new cars, the whole ministry, not only in Kunene, everywhere. And the other thing is also, the communities have requesting of gazetting of those community forests, but it's delayed. Those people or those communities, they are losing out of protecting this. There is no a law which is, or policies which is giving them powers so that they can control cutting of these trees of the community belonging to them. I mean the forest. So I'm requesting the ministry at least to fast track the gazetting of the community forest as they requested by either conservancies or community themselves, at least to have an ownership. The other thing which is very important, it was already said by the honorable members here, is the cut lines. It's very important. Just now, the grass is drying up, becoming yellow. The fire it will take. Fire mostly never take the green one, they take the dried one. And if we having enough grass in some areas or some regions, this, if it is a fire, field fire break out and we do not have these cut lines on time, it's going to be a disaster. So I'm requesting the ministry at least to equip themselves with those firefighting or whatever equipment they used to use, and to quickly or on time to have those cut lines at least. And the other thing is that Honorable First Vice Chairperson, honorable members, it's the recruitment of this ministry. There is only few in Kunene region. If a person retired, never replaced. And I was informed the whole Kunene having only 6 people. 6 for 7 constituencies. 6 like this. -1. And there is money there. So I want this money to be used to recruit staff there to that ministry. People are dying of crocodile. People, they are not attended. And I was so disappointed to hear that you to be compensated, you have to what? They have to follow this, to follow the what? The meter of your crop field. So I don't think that measurement is really make justice to the owner of the crops. Thank you very much for the opportunity, and thank you, Honorable Chairperson. Thank you.
Thank you, Honorable. Any further discussion? Any objection? Agreed to? We shall now put vote 24, transport. 23 works. Sorry, man, the fatigue is kicking in. Vote 23 works with an amount of 805,300,100 Namibian dollars. 1,000 Namibian dollars. My apology. Let me repeat it again, with an amount of 805,301,000 Namibian dollars. Any discussion? We're talking about transport. Honorable Nambondi and then Honorable Simasiku. Works.
Thank you so much, Honorable First Vice of the Committee of the Whole Council. I will be brief, straight to the point. Let me also partake on the vote 23, which is works. It is, however, it's therefore important for all government offices to adhere to the stipulated requirements of having a building maintenance strategy in place to ensure that all our buildings are maintained to the requirement standard. The Ministry of Works must therefore ensure that all government departments development and implement the requirement building maintenance standards. This will be ensured that maintenance of the government building is planned well and less costly but quality. It's therefore unfortunate that when one looks at most government buildings, all you see is cracks and lot of non-functionary building assets. What is even more appalling is that buildings which are only 5 years old also have a lot of cracks and the various defects. This makes one wonder if building inspectors are doing their work at all. It also makes one question the initial architect work was done and approved by the Ministry of Works before this building was erected or constructed. For example, in Ohangwena region, if you happen to go go there, the constituency office, it's had a lot of clerks in Ohangwena, or the constituency office of Ohangwena. I say Ohangwena in Enana constituency office. Back to Oshikoto, Omsia constituency office, teachers' houses, particularly in Ontana Combined School, in Okankoro constituency. These houses were just built recently, but if you happen to look on top of their roof, it's already reddish, but not a paint. It's indicated that a poor material was used, and the building inspectors, they approved that houses to be used. Currently, there are, however, concerns regarding the amount of money spent in cases where maintenance work is carried out on government buildings. There is a need for the Ministry of Works to develop and implement cost reduction strategy in maintenance of the government buildings. One such strategy could be used for vocational training centers that students from this center can be used for maintenance, and it will be very costly, and I'm sure that their works will be on a quality work. With that, Honorable First Vice, I so submit.
Thank you, Honorable Simasiku.
Thank you very much, First Vice Chairperson of the Committee of the Whole Council. First of all, let me register my appreciation and support to vote 23. With a very able new minister, very capable, and I'm certain that he will carry out all the assignment on behalf of the governing party. A few remarks, however. Number one, the maintenance budget for ministries in regions. The current arrangement is that each ministry keeps their respective amount of money for maintenance of the facilities of government. But it's always a struggle whenever staff of the maintenance division want to go and fix certain things here and there. It's a struggle to access the money. So my suggestion is that perhaps these funds should be availed to maintenance division so that the works can be done speedily. We have a scenario where in some offices, even fixing taps, you get a quotation. And that's where we have a problem, because these people, the smaller SMEs, unfortunately, there has to be a markup. Because if a tap is costing 300, obviously he will quote you 600, and unfortunately you have to pay. And that's where we are creating a loophole in the system. And eventually we are being caught off guard. The second most important part that I wish to put to the attention of the Honorable Minister of Works, Comrade Nekundi, is particular to Katima Mlio. There was a government alienation scheme where most of the government houses that are located in Boma. By the way, Boma used to be a prime location of very, very big houses, beautiful houses. But if you go there now, it's an eyesore. It's horrible. Because these houses, most of them are abandoned. They are not maintained. You'll find that one house, the person who used to stay in that house retired 15 years ago, but the house is still registered under his name. In some cases, with caravans, the house is gone. There's just a piece of land there. But the Ministry of Works keeps paying for rates and taxes over nothing. And that to me is a problem. There was a time when the ministry and some residents were offered to buy some of these houses. We don't know what happened in the process. And what we have now is very uncomfortable. So these houses are old, unmaintained, and they've made that location like an informal settlement. So I call upon the ministry to fast track the process of selling those houses to those who are willing to buy. In fact, there's a lot of people who want to buy such houses. But for whatever reason, there's some issues in the ministry. And I think this will also help them in updating their asset register, because they will then discover a lot of things there. Someone retired 20 years ago, but he doesn't want to leave the house. So that's my small contribution, and I hope that the ministry will sort out this mess, have these houses sold, so that they can get off their bills some of these unnecessary expenses. I so submit, Honorable First Vice Chairperson. Thank you very much.
Honorable First Vice Chairperson of the Committee of the Whole Council, honorable members, I think the time is not with us. We should be brief. Well, I rise to contribute on about 24 transport, with more specific to road infrastructures. First and foremost, I have to congratulate Honorable Nekundi in his new role. He's a very experienced person since he served the ministry by then as a deputy minister. So and I know his knowledge in the industry is quite vast. I really do not want to emphasize the importance of roads, but we know that roads do link us together as people, as villages, regions, and be it other countries as well. And for a country to be commercially viable, I think road infrastructure should also be of good standard. Then the issue here is disparities within the road in the infrastructures. If we go to regions, by regions, I think we could really see a very huge gap between roads that have been constructed in certain regions compared to others. Kavango West is not an exception, and as far as I know, roads that goes inland, none has been completed since our independence 35 years ago. And but if you compare this with other regions, I think there is a very big difference. Kavango West doesn't have a tire road that goes inland, apart from the trunk or the highway ones. So therefore, I think my appeal here is that the minister is, of course, has been in the region sometimes back. He knows about it. And there are times that the minister should really use this mandate. I think Article 40A of our Constitution can still allow the minister to look into that, to this, so that he could balance these issues. This is one of the priority of the region. Road infrastructure is a crime. And so if you go to our voters today, the first thing that they will ask you is roads that goes inland. So with that said, I hope that the minister is also listening, and he will pay attention to this. Yeah, with that, I have to support the vote. I so submit. Thank you.
Thank you. Next. Honorable Lukazi.
Thank you, Honorable First Vice Chairperson of the Committee of the Whole Council, honorable members. I rise to make my contribution on vote 24, transport. So I just want to highlight a few things as usual, honorable members of this August House. I rise to make my contribution, transport, specifically emphasize on the status of roads in Zambezi region, which I represent, both the achievements and also comments and challenges that hinders progress. First, with achievements, I wish to commend the Ministry of Transport, Minister of Transport, for the job well done in enhancing the road infrastructure in Namibia, and also to make some connections in Zambezi. The completion of the road, the Brendan Simbwaye one, it's one of the achievements. And the starting of the Muyako one, and also the rehabilitation of the Trans-Caprivi Highway, which is ongoing. Every now and then you will find from Katima up to Grootfontein, you will find it's maintained to make sure that we drive safely. So it's really an achievement to us, and we need them to do the good job. And also in Sibinda constituency before Chinchimani, there was an area which was having a lot of water. You could find that area also has been achieved. But challenges now. Challenges, number one, is the delay in the implementation until the budget. We don't know either is aligned in November or what. So you'll find like last year, I raised here to say there was a road that was from Sibinda to Makanga, which connects the clinics and other social activities to Sibinda. That road was budgeted under MTEF. And this year also, it came, last year was 10 million, now I saw a 13 million on the MTEF. But the implementation, we will go without realizing it. I therefore call the ministry, or the Minister of Transport, to make sure that they speed implement this budget. Last year budget, when we approved it, you remember it was more, but during the alignment, the additional budget, the midterm review, you'll find that more than 900 million was aligned to other. So the ministry during the midterm review, the budget of transport during the midterm review, we are aware that it was reduced. But now we are approving. So we don't want a similar thing to happen this year, that during the midterm review, the budget is now not seen. With these few words, I support the bill and call for an implementation. I think
you are supporting the vote.
I support the vote with all the recommendation. I so submit.
Thank you, Honorable Nambondi.
Thank you so much, Honorable Vice Chair of the Committee of the Whole Council, Honorable Member. To cut stories short, let me say, Honorable Members, government can only render quality services if there are roads connected to the center, village, settlement, and even to the region, between region to region. The ministry formulates a well structure on how to allocate budget to its department. But I fail to observe funds allocated to access roads. More schools, it's find difficult to attract qualified teachers to teach in rural areas due to unavailability of access roads, like in Oshikoto, Kavango West, the Kavango East, and Kunene too. I do have an idea how the ministry should set aside or allocate the budget specific to each region so that the region can deal with its own budget and implement its projects and the monitoring. This will be easier rather than a person who stay in the window, but he or she monitoring works carried out at the region. Honorable Vice Chairperson, Honorable First Vice, MTEF, medium expenditure framework, indicated that the road between Okankoro to Onkumbura is completed. But it's, in reality, nothing has been done on that road. Nothing has been done on that road. In 16 November 2020, there was a tender in a New Era newspaper for company to construct gravel road in Oshikoto region. Road number D3603. Till to date, nothing has been done to that gravel road. I don't know what happened to other regions because it was a tender document where they also some roads added, such as MR 115, that is between Karara to Okonjatu, and the D3710, 3710 in Kunene region, and the others, there were more. Community are used to flank to our office, to constituency office, asking those questions. But you as a councillor, it is so difficult to give a right answer because, like what I'm saying, that the person who monitoring those works is here in the window. Instead to delegate those functions to the region, then work will be done easier. Or I so submit.
Thank you, Honorable Amunchindi.
Yeah, thank you very much. The first Honorable Vice Chairperson. I want you to wake up. You were sleeping. So I just like to make a contribution. Because of the limited time, I just want to bring the following gravel road to the attention of the Honorable Minister, my comrade in arms, that need his urgent attention. DR 3678, this is a procurement law in Uvudia constituency that had been proclaimed a long time ago, but it's not yet constructed. So therefore, the Honorable Minister should at least avail the budget to construct of this road to make easier for the community in Uvudia to have a road that connects them to Oshakati and to the constituency office. Number two, I want also to submit the very busy road, one of the very busy roads in Oshana, that is DR 3636, the system Heke Onakamandi, that need to be upgraded from a gravel road to a bitumen or a low volume seal, because many motorists, they are using this road because it's connecting more institutions, like two Class C police station, one is at Heke and one is at Onakamandi. And also it connects to two clinics, the Heke clinics and the Hafo clinics, and the settlement, which are about to be upgraded to a village council as per the Oshana Strategic Plan 2025-2030. So it needs to be upgraded to bitumen standard. Again, I want to submit the following road, gravel road, that needs to be re-gravelled because the gravel sand is finished. Is DR 3637 or Kapsa or Harushu? It needs to be re-gravelled. Is DR 36060 or Akwenyaga or Mawangati? It also needs the attention to be rehabilitated. And also DR 3644 on Punja on Akamandi. All these roads need to be rehabilitated. Oshana Regional Road Board, on the 2nd of October 2024, they resolved and submitted the following road to be proclaimed. That is Ondangwa Home Affairs, from Ondangwa Home Affairs, Orukoro, Kupira, Ejehongo, Ombandakani, Omkandu. That road need to be proclaimed because those schools normally close during the flood season. And also we submitted a road Ombandakani, Heke Settlement, Amgada, Orurongo, and the leak at M92 or at Omarara. It's very, very paramount law that need to be proclaimed so that the community member in between there, they can have access to the main law. This, most of the road that I have mentioned, it connected various schools that were closed this year during the rain season. Once they proclaimed, we avoid the closure of school in the near future. Finally, Honorable First Vice Chairperson of the Committee of the Whole Council and Honorable Member, I want to applaud the Minister of Work and Transport for appointing contractor to upgrade DR 3605 Oluno Ukuyu Shona to be a low volume seal. The contractor is on the site, but they only given to upgrade it for 15 kilometers and they leave 8 kilometers, which is up to Omkando. I want the minister, I appeal to the minister to mobilize more resources so that the contractor can finish the whole road, that 8 kilometers, so that it make easier for the ministry to save money instead to go and appoint another contractor to come to complete the remaining kilometer. So otherwise, they would ask them an additional fund for the establishment of a new site. Therefore, Honorable Member, Honorable First Vice Chairperson of the committee, Honorable Member, I support the vote. I so move.
Thank you. Honorable Shikulo.
Honorable First Vice Chairperson of the Committee of the Whole Council, honorable members, I will be very brief. First of all, I would like to join my honorable members who congratulated Honorable Veiko Nakundi.
I would like to convey our appreciation and gratitude to the Ministry of Works and Transport in collaboration with Roads Authority for the ongoing project to upgrade the Otsandi Onguru Wombashe and Sandi Onesi Eparera Road to beat the bitumen standards in Umsati region. The road project has made notable progress and great milestones have achieved. But we have a problem in Ogongo constituency. Ogongo constituency, in February, March, even the councillor cannot enter into his office. And this one is a long time. There's no gravel road, there's nothing. I want the minister to look at this one because this one is a long time now. Come again?
Honorable member, please.
Yeah, no.
Honorable Jigulo.
I will come later.
Just
We are
continue.
also, that's why I just want the minister to see this one because I just want to mention a few because of the time. Ogongo constituency must be relooked. And we are also having Okahao in Dirangadi Clinic, Gravel Road. This one, the Minister of Works and Transport agreed to repeating the bitumen standards once they are done with the two, which I was mentioned before. This clinic is for expecting mothers in the region, the whole region and surrounding. But now, if you see the expecting one to travel in that gravel road, you sometimes you cannot. Sometimes you worry. It's worrisome to say how can not the government put something which these people can work smoothly, and the government is ready for that one. And I just want to appeal to the minister to look at this Idirangadi clinic to be finished. Only the kilometers only 80 to 9 kilometers there. It's not long distance. During this rain season, there was a problem between the Okahao and Idirangadi. But lucky, we didn't have a complicated case for that. Otherwise, people were gonna stuck there and cannot reach in the hospital because of the death road. That's why I'm appealing to the Ministry of Works and Transport together with the Road Authority, and most particularly Honorable Nekundi as a minister, to must take appropriate measure to address this situation, Okahao and Idirangadi, so that we can save our expected mother. With these few words, I support the vote and I so submit Honorable First Vice Chairperson. Thank you so much.
Thank you. Honorable Goga.
Thank you, Honorable First Vice Chairperson of the Committee of the Whole Council. I will just be brief, but let me congratulate the Minister of Work and Transport, Honorable Nekundi, for being appointed as a minister in that ministry. I can even see the pace, because he's a young man and the blood is boiling. With that said, I would like to tender my disappointment, Honorable Minister. And, okay, and it's in regard with a Duplessis Epokiro road. Honorable Member, I can tell you now that that road has been budgeted for over 20 years. It is only 42 kilometers. 42 kilometers. But the contractor that was given the tender to construct the road only managed to, it is a bitumen road. Only happened to construct for 8 kilometers. He cannot finish a road. And the same contractor was given another tender to construct another road, Kobabe Soshombinte Road, by the road authorities. So which means now, these contractors, instead of now doing a Bukiro Duplessis Road, he took the equipment, he went to start now Soshombinte Road, and this one was now left out. And I call upon the minister, Honorable Nekundi, and I would like to quote what the former Deputy Prime Minister have said, Honorable John Mutorwa. He even realized and said that when it comes to bitumen road in Omaheke, is neglected, unquote. And I would like to call the Minister of Works and Transport, at least for this financial year, with this 2 billion, instruct your road authorities so that they can finish the Duplessis Epukiro Road. This is long overdue. And I don't understand of, while the company is not constructing giving tender to construct the other road, is be given another tender. The same company is where the problem is coming in. Honorable Nekundi, Minister of Works, I would like, he's listening to us here, and I would like to tell him that, please, with your budget, in this current financial year, finish Duplessis Epukiro Road. Honorable First Vice President, I so submit and I support the vote. Thank you.
Thank you. Any further discussions? Any objection? I see none. Agreed to. Honorable members, I shall now report progress and ask leave to sit again. Good afternoon, Honorable Vice Chair. Honorable Vice Chairperson, the Committee of the Whole Council have gone through vote 40, my apologies, vote 13, vote 14, vote 18, vote 23, and vote 24 of the Appropriation Bill, Bill 6 of 2025, and has agreed to the said vote. I now ask leave to sit again.
Good afternoon, honorable members. I hope you are still fresh with this harsh marathon. Yeah, thank you very much, honorable members. That was the order of the day. It is in accordance with Rule 30 sub 1 of the National Council Standing Rules and Orders that I adjourn the House without a question being put. The House stands adjourned until tomorrow 9:30 sharp. So the House adjourned.